Do you have problems sleeping? Is it affecting your quality of life? Do you experience fear and frustration when it's time to go to bed? If so, you may be suffering from insomnia. You're not alone. Almost half of people have had problems sleeping at some point within the past year, and 1 in 5 people live with insomnia nightly. But there is reason for hope. Insomnia can be cured naturally without the need to use medicines by applying cognitive behavioral therapy. For short, we will call it CBT. You can think of insomnia as a train that has gone off track, causing the ride to be a bit bumpy, and CBT guides your brain back on track. Hi, I'm Wendy, and I'll be your guide through this Sleep Easy CBT program. We'll go through 5 videos. This first one is an introduction to sleep and insomnia. In the subsequent videos, we'll teach you how to apply good sleep habits, relaxation techniques, stimulus control, sleep restriction therapy, and ways to optimize your sleeping position. We'll also discuss sleeping medications and their proper role. Finally, we'll summarize the information and help you develop a plan. This educational video series is intended for those suffering from behavioral insomnia. The information contained in these videos are not meant to be comprehensive nor intended to make definitive treatment recommendations. If your symptoms are severe or if you have medical conditions that can cause sleeping problems, like sleep apnea, restless leg syndrome, or depression, you may need to talk to a doctor. If you're having a medical emergency, get immediate medical help. Let's start with a quiz. I'm going to ask you 4 questions to test your knowledge about sleep. How many hours of sleep do you need? Which is the best answer? 4 hours, 7 hours, 9 hours. It depends. Or none. Sleep is for wimps. If you chose T, it depends, you are correct. It depends on the amount of sleep you need to feel rested and to not struggle with sleepiness when you're awake. The amount differs from person to person, although on average, most people need 7 to 7.5 hours of sleep each night. Let's go to the second question. What's the best way to improve chronic insomnia? Is it relaxation techniques, sleeping pills, acupuncture, exercising before bedtime, or listening to your spouse's problems? Sleep medicines like Ambien tend to be only partially effective and work for only a few days or weeks until your brain gets used to them. Acupuncture has not been proven to work for most people. Exercising is very good for your sleep and should be part of your daily routine. However, you should not exercise within 3 hours before bedtime because it increases your body temperature and stimulates you. Instead, the best time to exercise is late afternoon or early evening. This causes your body temperature to drop after the initial rise, which can help you sleep better at bedtime. While we applaud you for being a good listener, you should set aside time earlier in the day to listen to your spouse's problems. The best answer is relaxation techniques. Deep breathing, muscle relaxation, and guided imagery are core components of CBT that we will review in video 4. Here's the third question. What should you do if you can't sleep? Should you eat a snack? Get up and do something boring? Drink a glass of wine? Lie in bed, so at least you're resting? Or wake up your spouse and complain? Waking up your spouse to complain is not a good idea. It can cause problems in your relationship and further worsen your sleep. It's also not a good idea to drink alcohol before bed. Even though it can make you feel sleepy, a few hours later, when it wears off, you actually experience heightened alertness, which can make it hard to sleep well, and it can cause bad dreams. It's best to avoid drinking alcohol within 3 hours of bedtime. Eating a snack can make you wake up to go to the bathroom and gain weight. The best answer is B. Get up and do something boring. If you can't sleep, don't just stay in bed. Staying in bed is one of the worst things to do. Instead of resting, you feel more frustrated and scared about not being able to sleep, and it conditions your brain to experience alertness rather than sleepiness when getting into bed on subsequent nights. After about 20 minutes, get up and do something relaxing or boring. Only go back to bed when you feel sleepy again. This is called stimulus control therapy, which we'll talk more about in video 5. Okay, last question. Does caffeine affect your sleep? Here are the possible answers. Or does it make you expend more energy so you sleep better at night? Sleep could be worse, but it's okay if you drink before 6 p.m. It can cause leg twitches, which affect your sleep. Finally, if you have to ask the question, you're not a real coffee drinker. Unfortunately, for all you coffee and energy drink lovers, caffeine can and does affect your sleep. The effects of caffeine can last for up to 12 hours, so it's best to limit your caffeine intake to before noon. The answer to the question is D. Caffeine can cause leg twitches or restless leg syndrome, which can make it hard for you to fall asleep or wake you up during the night. I hope you learned something from the quiz, and maybe even had a little fun too. This video series will teach you cognitive behavioral therapy tools and show you how to incorporate them into your sleep plan to help you sleep better or cure your insomnia. Now let me tell you about 2 people I know who had trouble sleeping. Robert, who is 72 years old, has had problems sleeping for 20 years. He goes to bed at 9 p.m., but it takes him several hours to fall asleep. He dozes off at about 1 a.m., but then wakes at 4 a.m., averaging only 3 hours of sleep a night. He lays in bed and reads or looks at his phone until 6 a.m. when he finally gets out of bed for the day. Sarah is 35 years old and has had trouble sleeping for 7 years since her first child was born. She goes to bed at 10:30 p.m. and can fall asleep within 10 minutes. However, she wakes up at midnight, tosses and turns, and is unable to sleep the rest of the night. Once a week, she will crash and sleep 8 hours before resuming her 1 to 2 hours per night of sleep the rest of the week. Do you have trouble sleeping, like Robert or Sarah? Do you share some similar experiences with their sleep difficulty? If you do, don't worry. After using cognitive behavioral therapy for 4 weeks, Robert was able to sleep 7 to 8 hours each night without waking up. Sarah, after 4 weeks of CBT, was also able to sleep for 7 to 8 hours each night with only a brief bathroom break. If you want to sleep better, like Robert and Sarah, keep watching the videos. Video 2 is about cognitive therapy. See you in the next video.